Welcome to the Cathedral's podcast, Crossroads. We explore the intersection of faith and the world in thought-provoking bi-monthly episodes featuring guests from around the world who are seeking to live faithfully in the public square. This is a safe space for tough questions around faith, politics, science, technology, and our responsibilities as citizens. Please join us as we search for a better way forward.
Hello and welcome to a new episode of Crossroads. I am delighted to be joined by the Cathedral's Canon missioner, Leonard Hamlin. Leonard, thank you for joining me.
No, it's a wonderful pleasure to be back and to join you in the program.
Also with us is a dear friend of Leonard's and of the Cathedral, Dr. Michael DeBaun. Michael, welcome. It's wonderful to have you with us.
Glad to be here.
Well, Michael, would you tell us a little bit for our listeners, what is your field and what are you working on?
Well, I am a physician scientist. I'm professor of pediatrics in medicine at Vanderbilt University School of Medicine. I'm the director of the Vanderbilt Meharry Sickle Cell Disease Center of Excellence. And I am vice chair of clinical and translational research for the Department of Pediatrics at Vanderbilt.
Thank you. We at the Cathedral, especially with our Crossroads podcast, have been exploring the intersection of faith and medicine. And we are also deeply interested in technological advances, if not technological disruption, that we're all seeing in all kinds of fields, but especially in critical fields like the medical field. And when Leonard told me about you, I was so impressed with all of your accomplishments. You're very modest in your introduction. So I will ask Leonard to maybe fill in some of those gaps, as well as give us a glimpse of how you two met.
Well, certainly, this gives me a great opportunity to say that it is a real pleasure and privilege for me to join in this conversation with Dr. DeBaun, as well as sharing a little bit of his experiences and expertise as we reflect upon these issues that are so crucial to us. First, it's a good opportunity for me to congratulate you as well on your election to the American Academy of Arts and Sciences. So we're celebrating that here as well too for you.
Well, thank you. It's a tremendous honor and really an opportunity to reflect on how I got to this point and who were critical members of the family and team to walk with me on this journey. It's a long journey, and I'm grateful for the love and support that I've received to acknowledge this membership in the American Academy of Arts and Science. It's a tremendous honor, frankly.
Well, you speak about traveling on the journey. Certainly, you've traveled the journey well. In that journey, as you mentioned, Sonia, we happened to meet while we were in college at Howard University. And now our families, of course, have been interconnected throughout the years.
Oh, that's so
Children
beautiful.
growing up, being able to watch our families come along and really share with each other, not only in life experience, but challenge each other and the kind of work responsibility that we would have in our unique, of course, travels and journeys.
Absolutely. Absolutely.
Well, I thought we could start by going back to some basic principles in medicine that also have very profound resonance in our faith lives. One of these principles, going back to the Hippocratic Oath, is that of doing no harm. It is one of the basic principles. And you mentioned this, Leonard, in one of our conversations. And you were reflecting on how this is also so pertinent and so much at the core of Christian pastoral care as well. So maybe I will go to you, Michael, first, and maybe you can give us a sense of what that means to you in practice and in how you think of your trajectory in medicine.
Yes, so this do no harm principle is the cornerstone of being a physician. And it's so interesting. The work that I have done that I'm celebrated for is almost tangential to the work that I've done where I feel like I can answer this question as an expert. I'm a board certified pediatric hematologist oncologist. And as a pediatric oncologist, we have to give the news to the parents and the child that the child has cancer. And I did that for a fairly long period of time in my career. And because of this concept of do no harm and really being transparent with the families about, we've reached a point where our chances of cure are minimal. I was asked by the staff to be the medical director for our pediatric hospice. And I did that for 5 years. I was the sole physician for the pediatric hospice team. I made home visits for 5 years. And I had to keep that principle close to my heart as I had to describe to families the journey of their child dying, and that there was no therapy available that would attenuate or abate the progression of the cancer. And so these are really tough decisions. They're actually best handled in their home and not in a hospital, in their comfortable setting. And then the families are constantly looking for another way other than the way of death. And so these challenges of how do you discuss the death of a child for parents, grandparents, oftentimes, and there would be clergy with them, in a way that says, my goal is to ease the burden for your child and your family. And of course, in a pediatric hospice, they're mandated by law to have a chaplain and to have other aspects of the care that allows for the siblings in pediatric hospice to receive therapy as well. So it was a team effort, and it really anchored me in my career as to what was permanent and important versus what was fleeting and unimportant. And do no harm was tantamount to the decision-making process and the discussion with the family.
It's interesting that, as a layperson, when I think of do no harm, the first thing that comes to my mind is to be very good and very careful about the person when you recommend different course of action from a medical perspective, right? So try to improve the outcome and try to make the person healthier and not actually cause more harm than the illness is already doing. But expanding from that, what you were referring to, Michael, was in a way a different kind of harm, right? A psychological, emotional harm, right, that can come from giving someone life-changing news in a way that is perhaps hurried or seemingly inconsiderate. And I think that in that aspect, the connection between doing no harm in a medical setting as in a pastoral setting, right? That's where I think the affinity is most strongly felt. And on that note, I wanted to ask you, Leonard, in your experience, how would you apply this concept to how you are approaching speaking with people, especially in moments of high vulnerability, like Michael was describing?
Certainly, there's many different ways to look at how it would be approached. And throughout my years, just as a member of the clergy, a person of faith, just in terms of from one person to another, you have different perspectives. As a pastor, there was another responsibility. And then I remember early on, I became involved with conversations with Howard University Hospital early in ministry that were looking at spirituality and medicine as they had that department then, and very engaged in how we find the intersection. Because while I speak, of course, as a member of faith and a clergy member, my grounding, of course, is in the Christian faith. And so when we look at life and life abundant, we should be looking at the fullness of life. And just as Michael was saying, there is the reality that we see that we're dealing with here, but there's more than that. There's much more. And how are we meeting a person, of course, in that moment? And of course, we have to meet them in that moment. I think there's always a desire to move someone beyond the moment. But if they're moving beyond the moment is because have an opportunity and a privilege, as he said, to walk with them through the moment. And that kind of wrestle, that kind of awareness, I think you gain through that team approach. And when you have individuals that can bring different perspectives and remind you of different things that you need to be aware of as you're navigating very unique circumstances. Because I think we would all agree that you can have sort of a similar broad circumstances, but they become very unique based upon the uniqueness of the persons who are both in the room as well as the person who is immediately affected by it. And you have to walk in that uniqueness and find that way. And we need each other to do that.
I think this team approach to caring for someone in need is something that both of you have mentioned from different perspectives, but ultimately you're saying very much the same thing, right? And that brings me to another concept that I thought we could explore in our conversation today, also coming from the field of medicine, Michael, which is treating the whole person. And I know this is something that has been discussed a lot in the medical field. But Leonard, in one of our previous conversations, you were saying that this is again something that is very germane to pastoral care as well. How do you approach this particular philosophy, Michael, in your work?
Well, again, it's a very simple question, but the reality is the answer is very complicated because what does holistic care look like? How do you describe it? So I'm going to give you a definition that was based on a heroin act of a holistic pediatrician in St. Louis, which is where I grew up. So my grandparents had three daughters. Two were healthy. The third had cerebral palsy. My grandfather worked in the St. Louis Public School District, and there was very little custodial care for a child who had severe cerebral palsy. So my grandmother was responsible for managing all of my mother and aunt's sister, who could not walk, limited ability to talk or communicate. She was her caretaker. And the pediatrician, Dr. Helen Nash, recognized that when Rita died, that this was a tremendous loss in the family. And so Dr. Nash, recognizing the almost immediate depression that would occur as a result of this death, and you can imagine providing medical care for a child, cleaning, feeding for over a decade, the death of that child is going to leave a huge loss for any mother. And the pediatrician, recognizing this loss, said to my grandmother, if you can go to school to become a LPN, I will hire you. And so that message was my model of what a physician should be. It's far less about the vitals and the chemistry that you observe when someone's in your office for 10, 20 minutes or longer. It's more about the family unit and understanding the impact of the family unit on the health of the child as a pediatrician and the health of the family. And so that has been, frankly, the cornerstone in my model of how I aspire to be a physician, a pediatrician explicitly, providing medical care for children with life-threatening disease.
Wow, that is an incredible example. I mean, it sets a beautifully high bar for how to care for your patients and not only the whole person, but the family.
I appreciate you telling that story. I had never heard that one from you. And to think how we are really affected by how we share with one another, how that is passed from generation to generation. And of course, these values. become important to us and how we're shaped by those experiences. I appreciate hearing that.
Leonard, what are your thoughts on this holistic approach?
We're always supposed to be mindful. I think there is a tension within many who are, as you say, sort of practicing their faith at times to separate body and spirit. Certainly, we come out of history where that has been done, and probably at some difficult times in our history, where certain people have been treated differently because there were those who supported that idea that the body and the spirit are not linked together, that one could be treated one way, another could be treated another way, and not have consequences as a result of that. But treating the whole person is something that we recognize should be first and foremost, and no matter what we do. And so looking at a person is to recognize that what makes them who they are is both body and spirit. I'm intrigued by what, Michael has shared because, you immediately started me to think about who has impacted me, and how I do what I do, and the way that I go about being mindful. And Michael is aware of this, that while I was in college, I had a near death car accident. When I think about those moments during that time, how both I would say, beginning first while I was in the hospital, at that time, there was a chaplain of Howard University Chapel, Dean Evans Crawford, who would come to visit me. And here I am laying in the bed, and he was already talking to me while I'm hooked up to everything about getting back to school and what I was going to be able to do. We became very good friends years later, and it raised so many questions about life and all. And when I went home, even leaving the hospital, shaped by the pastor who talked to me about life, not just about how I was seeing the moment or my spirit or being encouraged, as many said, the inspirational piece of that. But how do you see that, and how are you inspired, and how you see those together? I probably hadn't thought about that until you shared that story, Mike, to make me think about it in that way. So, we're all impacted and get a view. And I think as we're having this conversation, and many others will hopefully have conversations about this, that we can extend or shorten each other's view. And so those consequences and how we are helping others to see further is both in what we're doing practically with our hands, what we'll engage, as well as what we may be envisioning in our spirit to be able to see further and then reach for it.
Mm. Wow, that's a powerful statement, a powerful recommendation for our listeners. Thank you, Leonard. Well, we were talking about models that can propel us forward. And I am thinking, of course, about these new innovations, new breakthroughs that we're hearing about everywhere around us. Many of them are revolving around artificial intelligence. Michael, have you encountered any changes or any disruptions, either in your field or more generally in the medical field, coming from these disruptive technologies like AI or bioengineering?
Yes. Well, I think disruptive might be perceived as being negative, but definitely AI is here. Computer algorithms to help you make decisions is basically what AI is. And the reality is that we've been using some form of computer algorithms to improve decision making since computers were developed. And I'm sure we all go to the doctor at some point and put our weight in, and the doctor spits out what your BMI may be without calculating it. And then he or she will say, you are not where you should be. Well, how does the doctor know that? Well, there's an algorithm that develops the quote unquote ideal BMI, body mass index. And that is a tool that the doctor uses to, or the physician uses to improve communication to the patient. And so what's happened more recently is artificial intelligence and machine learning has accelerated this approach to patient care we are still learning. We're literally, I think, in the very first step of a marathon in terms of how AI will be used to improve healthcare, and is already being used. There are already pre-existing strategies to curate well-established repositories of information to help physicians make diagnoses. And then I attended a meeting a year or so ago where the typical use for EKG that we put on your heart to see if you have an abnormal heart rhythm, machine learning with artificial intelligence has actually been able to pick up clinical signs of non-heart disease that goes beyond what the EKG was designed to tell you about. And so we're really on the brink of understanding all information that's made available. And then last but not least, it's a wonderful tool to facilitate learning. I mentor multiple teams in Nigeria and a team in Ghana, and they are often lacking the library resources and access to journals, medical journals, that I have at a great institution like Vanderbilt, free of charge. They often have a limited capacity to perform statistical analysis. And now we're able to support them in getting equipment, phones, iPads, and the like, where they have AI access. And the growth in the last 6 months has been phenomenal. And in fact, we no longer have a note taker that used to take 3 to 4 hours when we're on our Zoom calls. We get the minutes immediately. We get a to-do list. They can do some of the statistics that they would have to wait 2 weeks to be done with the artificial intelligence and check it. And so I see this as any other innovation in technology. Those who adopt early will be able to use that to advance medical care for patients.
I know, Leonard, that you've been experimenting a little bit with some AI tools in terms of your own writing. And I know that other colleagues on clergy here at the Cathedral are doing the same. Of course, with a large language model that is not personalized, like ChatGPT, for example, you can get only that far. But, if you use one of their more sophisticated, newest models or a dedicated small language model, then you can kind of teach it who you are, your voice, and have all of your writings and all of your thinking that's out there in the world as their data set, to help you. What have you learned, and how has that experience evolved?
Certainly in trying it, and I'm really on the brink of just trying and jumping in that deep water. But it's been interesting for me to see how things may be stated in certain ways, or reformatting and said, yeah, that was what I was thinking, I just didn't write it down like that. That's what I may have wanted to say, or to use different perspectives. I often question, at what level can it capture sort of the real emotion, though, and the passion that is there. But I think that's my responsibility, to make certain that no matter what may be in the letter, that the spirit can somehow live beyond that. And I have to still edit, just as you were saying, Michael, that we go back, we sort of edit, we look back and make sure that we've checked, that we've done the kind of work. So I've done it in small ways, trying to see even, this is the way that I would say it, throw something in there and see how would you approach this subject, and to see what's missing, what's not there, what gets left out, what's the, as we often say, the human dynamic versus the computer dynamic, what comes out of that.
And the different ways of expressing the same idea can actually
Yes.
make a huge difference in someone understanding it, being persuaded, thinking a different way. Right? The words we use are very important. And Michael, you were talking about hope, and as we're coming to the conclusion of our conversation today, that was my final question for both of you. What brings you hope these days in your profession and for the future generations?
Oh, my wife would tell you I'm a romanticist. I believe in the future. I believe that the young will do better for this world than we have. They'll be better caretakers of Mother Earth, of each other. And I have 3 grandchildren, the 4th one on the way. And I am just so optimistic that they're going to be able to do things that I never even dreamed of. And my mentees, they are inspiring. During the window where we thought that the budget was going to be cut for a large grant in Nigeria that actually will improve the healthcare for children in the United States, we had a moment of clarity. Do we just stop with the knowledge that the government's going to shut us down, may shut us down, or do we continue? And to a person in this team of over 20 people, they said, we will do the work free. We will not abandon the patients. And every patient that we committed to in this trial, we will follow through on that commitment to the end. So I'm very optimistic that that is the spirit that allows us to love each other, to care for each other, and it's not dependent on a financial windfall. It's dependent on a spiritual windfall of doing well for others. And I'm convinced that that's going to drive the future.
That's beautiful. Leonard, a final word?
Well, I appreciate, as we're always looking for those areas of hope. And, in this conversation, what brings me hope is that there will always be those who are unwilling to settle because of something that is in there, as I use language that is familiar for me, that is in their spirit, that they will continue to question what's ahead. How do we get there? Certainly, if I were, using similar language as my colleague and say, whether it's you call it researching or examining, exploring, the questioning, it's the question. We're living at a time where a lot of people want answers, and that's probably been true through history. But there's always been a remnant and a significant portion of individuals who will raise questions, no matter how difficult or no matter how much challenge. If we think of even the young as he raised, just that child who's sitting in a classroom, who's not worried about raising their hand because everybody's going to tease them, and I'm going to ask my question. There's going to be someone who will raise those questions and who will seek. If I put that in our religious language, I know that our Creator is a rewarder of those who diligently seek, and to seek him in particular, but to seek, to raise questions, who are searching. And sometimes that can be very difficult. But I have hope because I constantly run into people like that.
It's very powerful. Thank you, Leonard. Thank you for joining us
Grateful
today.
to be here.
And thank you, Michael, so much for being here with us today. You've given us so much to think about.
Well, thank you for inviting me. It's been a real pleasure to think about these questions and to be on the panel with my buddy, Lenny.
Thank you.
For our next episode, we'll be in conversation with the Reverend Dr. Russ Levinson, an Episcopal priest, pastor, and author. Russ, for over 15 years, served as the rector of St. Martin's Episcopal Church in Houston, Texas, which is the largest Episcopal parish in North America. Russ is the author of several books, including Witness to Dignity, The Life and Faith of George H.W. and Barbara Bush, In God's Grip, What Golf Can Teach Us About the Gospel, and his book that we'll be talking about for this episode of the podcast, Witness to Belief, Conversations on Faith and Meaning. I hope you'll tune in for a conversation on the faith that sustains us through the highs and lows of life. Russ shows us how people across many differences, including in terms of how they came to know God and have a relationship with the divine in their lives, can inspire us in our own faith journeys through meaningful conversations such as those in his new book. So I hope you'll join us for some time together with Russ Levinson. Thank you for listening to Crossroads, and until next time, many blessings. If the digital offerings of the Cathedral enrich your daily life, please consider becoming a supporter today by making a gift at cathedral.org/inspire.